Hi there, I'm Dr. Jason Lipscomb. I'm a dentist here in Fredericksburg, Virginia, and today I want to talk to you a little bit about sleep apnea and more specifically dental sleep apnea therapy. For those of you who don't know, sleep apnea is a very dangerous disease that affects a lot of people in the population. And a lot of people, when you say sleep apnea, you automatically assume that it's just snoring. Somebody is just snoring. That's not the case. Sometimes snoring does happen with sleep apnea, but sleep apnea is a period of time during sleep where somebody stops breathing. You may know of somebody that snores very, very heavily and you have witnessed them stop breathing. This is called an apneic event, and it's very dangerous, and it affects a lot of our health. It affects our heart health, among many other things. But nowadays, dentists, along with sleep physicians, can help provide therapy for sleep apnea. Dentists can provide therapy through the use of oral appliances to reduce what's called obstructive sleep apnea, which is a blockage in the airway. So let's talk a little bit about what sleep apnea is and what a dentist like myself can do to help out with sleep apnea. Now, most dentists, like myself, will treat what's called obstructive sleep apnea. And obstructive sleep apnea is a blockage in the mouth or in the throat or even in the nose that is reducing the airflow coming in while you sleep. And there are other types of apnea, but this is the one type that most dentists will be able to treat. Now, the most common cause of obstructive sleep apnea is a blockage. So one of the types of blockages is somebody laying on their back, falling asleep, and their tongue falls back and obstructs the mouth. It obstructs the air coming in through the mouth. And that is why you get that noisy air coming in, being pulled in, and it passes by this blockage, causing that snoring. Even worse, if that air gets pulled in or doesn't get pulled in, it causes a complete blockage and a person is not getting any air in. So that is very dangerous. Another form of blockage is soft tissues block the air coming in, whether it be from weight gain or alcohol intake, which can relax the muscles and cause them to block the airway, or even advanced age. Advanced age, over time, muscles don't have that tone like they normally do when you're young, and they can fall back and block the airway. That's why people who are over the age of 50 have more of a risk for obstructive sleep apnea than much of the other population. Now, when this air gets pulled in past these blockages, the air becomes noisy snoring. We all know somebody that snores. We all know what it sounds like. It's that air trying to get past that blockage, and it becomes choppy, and that choppy snoring sound. Sometimes if that blockage is enough, that sound stops and that person stops breathing. And some of us have probably seen somebody who snores or has stopped breathing like that, and it's very, very scary. It's like they just stop. So it is very dangerous. We can help provide therapy for snoring, but the blockage, the total blockage in the sleep apnea, obstructive sleep apnea, is very dangerous, and that's why we need to evaluate patients and get you into the office and check to see if you have sleep apnea and see if we can avoid that. Now, this is a video that's on YouTube. This is actually a gentleman named Richard, and he has sleep apnea, and his sleep apnea causes him to only breathe once a minute. So imagine even holding your breath, just breathing once a minute. Most people would not even be able to do that if they tried, but he is doing this unconsciously in his sleep because of his sleep apnea. Now, when most people think of, hey, it's not that bad to hold your breath for a minute. If I were to tell you to say, hey, hold your breath, you would probably go and breathe in very deeply to be able to hold your breath. That's a conscious response to do that. Most people who have sleep apnea don't do that big breath in. They are not breathing, but they're not breathing. They've stopped breathing, but it's after they have exhaled all the way. So they're not pulling in that air. So take a little quick test. I want you to kind of blow out most of the air in your lungs and then try to hold that for a couple seconds. It doesn't take long for that uncomfortable feeling to come on and say, hey, I need to breathe. So imagine that this guy is feeling that way for over a minute, and he's only once a minute is he breathing. Some people with sleep apnea could do this 20, 30 times an hour. Can you imagine how that would make your body feel? You would never get the proper rest that you need. Your body is always in that panic mode that you have to breathe that air in. It's a very scary feeling. So this is what sleep apnea is. It's not good for the body, and your body is telling you it's not good for your body when you try it when you're awake. It can be very dangerous, and it can affect a lot of portions of your health. So let's talk about that a little bit and what sleep apnea can do to you. One of the big things is cardiovascular health. Heart attacks and strokes. Sleep apnea is deadly. You've all heard of people that die in their sleep or that wake up and have a heart attack first thing in the morning. It's not uncommon. It happens all the time. And in fact, with sleep apnea, you are 28 times more likely to die from a heart attack or stroke. It's that dangerous. It's something that we really need to evaluate. Some of the other things that sleep apnea is associated with is daytime tiredness. We've all heard of the truck driver who's driven off the road, or somebody that's driven off the road because they've fallen asleep at the wheel. People that have sleep apnea don't get good sleep at night, and they have a lot of daytime tiredness, and it's very dangerous, especially when they're out driving a car or a truck. Some people that have sleep apnea also have a problem with high blood pressure. Over half of sleep apnea sufferers have high blood pressure, and this is a lot of times because of the reaction to your body to not breathing and the low oxygen levels. It drives your blood pressure up, and it can be something that can be carried over into the daytime. Diabetes, obstructive sleep apnea can also make type 2 diabetes worse. There are many things that go along with that. Obstructive sleep apnea can cause snoring. Over 40% of adults snore. They're not always tied together, but snoring may be a clue that you have sleep apnea, or somebody that you love has sleep apnea. So it's a good thing to know that you do to evaluate whether you have sleep apnea. But there are people that don't snore with sleep apnea, and they're called silent apneics. They have sleep apnea, but you never hear that loud snoring. So they're not always tied together. A lot of people with sleep apnea will have headaches. Nighttime grinding of your teeth can contribute. Your body goes into a panic mode because it does not have that oxygen level in there. And you can have rhythmic movements of your jaw, which can be detrimental to your teeth. And that's something that a dentist like myself can see when you come in. Heart attacks, like I said before, obstructive sleep apnea greatly increases risk of sudden death from 12 a.m. to 6 a.m. Greatly increases risk of sudden death from the time you go to bed to the time you get up. It's a very stressful thing on your body to have that happen all the time. Up to 63% of stroke sufferers experience sleep disordered breathing. With low oxygen levels and then high blood pressure, this is a recipe for a stroke to happen. It's very easy to happen when your blood pressure gets driven up so much. There are recent studies that have also made links between Alzheimer's and dementia with sleep apnea, and the lack of the low blood oxygen level contributing to these diseases, which is very interesting, as a lot of people, as they get up in age, are more likely to have sleep apnea. So this is very easily tied together. Now, for most sleep apnea sufferers, the gold standard of treatment is what's called a CPAP machine. Now, this is a forced air machine that helps reduce the blockage. It helps bypass that blockage, that obstructive part of obstructive sleep apnea, and it is the gold standard because it is almost 100% effective. The problem is the current treatments are not always the most comfortable. A lot of people can't tolerate the CPAP machine. Some people feel claustrophobic. Some just can't tolerate it, and then others just wind up not wearing it, even though they need it. So this is where the dentist comes into play, because we can help out and we can actually create oral appliances or oral mouthpieces that can open your jaw and move your bottom jaw forward to reduce that obstruction and allow that air to come in more easily. And sometimes it's even used with a CPAP machine to make the CPAP machine more effective and then hopefully make it more comfortable. In some mild to moderate cases, some people can switch over from a CPAP machine to an oral appliance. But once again, that is we need to check with your sleep physician and work closely with them before that decision is made. And we need to do lots of measurements to make sure that is possible. But many people that can tolerate the CPAP machine, great. It's 100% effective. We're not trying to get rid of the CPAP machine. We're just trying to help those who can't tolerate it or those who want to reduce the pressure on their CPAP machine. So what can I do for you? What can Dr. Lipscomb do for you? What a lot of people don't realize is you see your dentist more often than your regular physician most of the times. You see, when people come into my office, they see me every 6 months. We talk about their family. We talk about what's going on in their life. I am able to glean a lot more information from you than you probably would give to your doctor. So this helps us in obstructive sleep apnea screening because I can see dental results like grinding your teeth or dry mouth or even your jaw position. Sometimes the way your jaw is positioned naturally will make you more likely to have something like obstructive sleep apnea. So your dentist can actually find the signs and symptoms that may make it easier for you to have a diagnosis. Dentists cannot diagnose sleep apnea, but we can help find the signs and symptoms to help point you in the right direction or get you the right treatment. In my office, we also have a take-home sleep study. A lot of you have heard of a sleep study where you go sleep at a lab. We have a screening device that you can take home that is somewhat similar, is very stripped down to what you would see at a sleep lab, but it helps determine if you are prone to sleep apnea or may have some of the signs or symptoms from sleep apnea. This may lead to a true diagnosis. You may have to go to a regular sleep lab, but this is a good measuring device to see if you have the signs or symptoms and help screen patients before they go to a sleep lab. And then finally, we can make dental sleep apnea appliances, and there are several different types of these appliances depending on what is comfortable for you. But we can make an appliance that hopefully will help you out and open up that obstruction and allow that air to come in. Most of them will reduce snoring, but snoring is just a little side thing. We need to make sure that the sleep apnea is taken care of first, and then the snoring is a secondary thing. But most of the time, if you treat sleep apnea, you will also treat the snoring. The snoring will go away with these dental sleep appliances. Now, this is one of the types of sleep appliances that I make. There are many different kinds. Some are much thinner to help people that can't tolerate something in their mouth, and then very streamlined. There are many different types, but we will look and see what type of treatment that you need and what type of treatment that is best for you. Many times we have to slowly adjust these appliances to find the right fit for you and to find the right proportions that will help your sleep apnea and get you to the point that you need to be. So many times they will move your bottom jaw forward to open up the airway. They will reduce snoring most of the times, and like I said before, they may make your CPAP usage even more effective. So the CPAP is the gold standard. If it makes it more effective and makes you wear it, that's a win-win situation in my book. So we've talked a little bit about sleep apnea today, but really if you think you know somebody that has sleep apnea, or your husband snores, or you feel like you snore, and you think that you may have sleep apnea, you feel tired during the day, you have high blood pressure, there are many different things that you can determine whether you have sleep apnea. But the best thing to do is make an appointment with me today, and we'll talk about your symptoms and see if it's something that's right for you. If need be, then we'll do a take-home sleep test and see if you have some of the signs or symptoms of sleep apnea. So do me a favor and give me a call today at 540-373-1641, and let's get you checked out and get you down the right path.